All right, so this is going to be part five, and this is likely going to be our last part. And we'll start here by talking about different types of skin disorders. And so there are various types of skin disorders, and we'll talk specifically about three types of skin cancers that are generally um, discussed in the literature and in you'll see in a clinical setting. These are basal and squamous cell carcinoma, and then melanoma. So basal cell, if you think about basal, this is referring to the stratum basal here, and so this is a cancer of the basal cells of the stratum basal. You find it on the ears, forehead, and nose, and I'll show you a picture of kind of a characteristic look and appearance for a basal cell carcinoma. A squamous cell carcinoma, you can remember squamous S for spinosum. It's affecting the cells of the stratum spinosum, and you find this generally scalp, ears, and parts of the hands as well. And again, I'll show you a picture. And then by far the most serious and most deadly and dangerous is melanoma. And so you may recognize melanoma from the word melanocyte. And so this is a cancer of the melanin producing melanocytes. Remember, melanocytes are also found in the stratum basal. They generally arise from a mole, and they will appear large, irregular in shape. They may change color, and they're highly metastatic. So meaning that they have a high likelihood of moving throughout the body. And so when you are analyzing a mole, and this is not necessarily for melanoma, but this is just analyzing a mole in general to determine if it is changing, you use the ABCDE rule. And sometimes it's called the ABCDEs of melanoma if you're worried about something that may be progressing and developing into a melanoma. And so the A is for asymmetry. You're looking, okay, is our mole, is it nice and symmetrical, or is it very irregular and asymmetric? B is for the border. Does it have a nice smooth border, or is it very irregular? C is for the color. Is it all a single color, or are there multiple colors? D is going to be for the diameter. Generally, and I forget the specific number, but moles over a certain diameter have a greater likelihood of becoming of being malignant than smaller diameter moles. And then the E stands for evolving. Are any of these things changing? Has the mole changed in size or shape from the last time you looked at it? Has it gotten bigger? Has the color changed? Was it all one color and now you see various colors? And so this ABCDE rule is a helpful tool and mnemonic for looking at moles and analyzing them and determining possibly if they are changing into what perhaps could be a more serious cancer. And so here's some pictures. Basal cell carcinoma is generally kind of waxy looking, very kind of shiny. Um, uh, Squamous cell carcinoma, again, stratum spinosum here. Little different, we said ears, scalp, hands, forehead, things like that. And then melanoma here, very dangerous, highly metastatic, large brownish patch with black spots, sometimes red or white speckles. And again, if you look at this and you use our ABCDE rule, very asymmetric. The border is very irregular. The color is very dark. Maybe it has changed a little bit. The diameter, this is a relatively large mole here. And then E, maybe this has evolved. Maybe it started off something very small, very um, non-threatening, and now it has evolved and changed it to something a little bit more serious. All right. Last thing we'll talk about are skin disorders with burns specifically, and then we'll talk about something known as the rule of nines. And so burns are a very important topic in nursing and in a clinical setting. There are lots of different um, hazards that burns present and bring about. One of them being the loss of fluid and electrolytes. That is generally the most immediate threat to life is the loss of fluids and electrolytes from burns. And then secondarily, whenever you disrupt your skin, we talked about earlier that the skin is our first line of defense. It's our most innate immune system. And so when you disrupt that, you now increase your risk of developing an infection. Okay, so loss of fluid, loss of electrolytes, as well as the development of an infection are some of the most serious things associated with burns. Now, we can categorize burns based on the degree of involvement of the skin. And so they're numbered first, second, third, and fourth in increasing severity in that order. So first being the least severe, fourth being the most severe. So our first degree is going to involve only our superficial epidermis, not a very serious burn. We generally think of this as being kind of red, maybe a little bit of pain, heals within a few weeks, and you can think of this as something like a sunburn. Okay. Our second degree is going to be all of our epidermis, and we'll begin to get part of our dermis. Now, you can even categorize second degree into two subtypes: superficial partial thickness or deep partial thickness. One being you get mainly the papillary layer of the dermis, one meaning you get into the reticular layer. This is a little bit more serious. Um, Maybe something, a kitchen accident, boiling water, something like that could maybe cause a second degree burn. Third degree, you're getting now all of your epidermis and all of your dermis. This is now getting into your nerve endings because we know in our dermis we have blood vessels, nerve endings, and you may see it become white, red, black, and you may have to have a skin graft um, depending on the severity, but probably you will. And then fourth degree is going to be obviously the most severe. You go all the way through the epidermis, you go all the way through the dermis, and now you're getting into underlying connective tissue structures. So things like muscle, tendon, ligaments, bones. Very, very serious. Um, Immediate threat to life. Again, you're losing lots of fluid, you're losing lots of electrolytes, and you're also opening up yourself for the risk of infection. Okay, so we'll look at some pictures here in a second, and I'll have you um, see if you can determine which degree of burn. But here's just a little chart that may help you in narrowing down what's first, second, third, and fourth. First, again, we said only the epidermis. It'll heal pretty quickly. Second degree, we said there was superficial partial thickness and deep partial thickness. One meaning you get mainly the papillary layer of the dermis, one you're getting the reticular layer of the dermis. Third degree, full thickness, you get all the epidermis and all the dermis. And fourth degree, you're getting underlying muscle, bone, fat, things like that. You'll have to have um, some serious medical attention associated with a fourth degree burn. Generally, amputation is a common thing that is associated with fourth degree burns. Skin grafting as well with third and possibly some with fourth as well. And so let's look at some of these pictures. So this image here on the left is this first, second, third, or fourth degree burn. Hopefully you recognize this as being first. This one here on the right, you can see maybe a little blistering. It looks a little more severe than our first degree here, so this is second. Here on the left, you can see we're getting some redness. We're maybe getting some white around the border. Here, maybe a little blister. That's going to be third. And so as you're going through these first, second, third, and fourth, think about the layers of the skin that are being involved. And then here on the fourth, you can see very, very serious. You see black necrotic tissue. You can see we've burned down to the bone here. And so this is very obviously a fourth degree burn. You can even see some blistering here in the palm of the hand as well. Now, with our third and fourth degree burns, so we have third here, we have fourth here. Are these burns going to hurt very, very badly? If so, why? If not, why? So pause it, think about it, and I'll go ahead and move on. So these are not going to hurt a whole lot. And the reason for that is that you have burned through all of your nerve endings. So if you remember, the nerves are primarily located within your layers of your dermis. And so if you burn completely through your dermis, you've also burned and severed your nerve endings. And so you don't have anything there to be able to detect and transmit the pain signal to the brain to be able to perceive that as being painful. Now, just because it's not painful doesn't mean that it's not serious. It's still very, very serious, but you may find that people who have a very serious third or fourth degree burn may not be in as much pain as you may expect them to be. And it's due to these severed and burned nerve endings that is resulting in that. Now, the last thing we'll talk about here is the rule of nines. This is a nice way to be able to determine the body percentage of somebody that was burned. And what I want you to focus on is just the adult here. Don't worry about the children. The children's changes based on their age. We're worried just about adults. Head and neck is going to be 9%. The trunk, anterior, and posterior sides will be 18% each. Each arm is going to be 9%. The genital area is going to be about 1, and each leg is going to be 18. And so learn what you have here. Anterior, posterior trunk, 18 each. Each arm is 9. Each leg is 18. Head is 9. And then you can determine the percentage if you have half of a leg or a quarter of a leg or only the anterior trunk or only half of your anterior trunk if you learn these different percentages here. And so focus on the adult as you start learning these. So we'll end here with some questions and then we'll be done. What is the function of the erector pili muscle? Well, we know that when it is stimulated, it will contract, pull on the hair follicle, and result in our goosebumps or goose flesh. Contrast eccrine and apocrine sweat glands. Well, we know that eccrine secrete their products directly onto the surface, whereas apocrine into the hair follicle. Eccrine are primarily involved with thermoregulation, where apocrine are not. These are the emotional sweat glands. These are found really all throughout the body. Apocrine are found primarily in the axillary and pubic and genital regions as well. Where apocrine sweat glands located, we just kind of talked about that, primarily pubic and axillary regions. What degree of burn involves only the epidermis? Hopefully you should recognize this as being a first degree burn. And then what's the body percentage that is burned here? So if we burn the entirety of our left and right legs, when we think about left and right legs, each leg is 18, so that's going to be 36%. If you burn the anterior aspect of one arm, so how much was one arm? One arm was 9, so if you did just the anterior, that's going to be 4.5, and then half of your posterior trunk. Each trunk, anterior and posterior, was 18, so if you did half of that, you're going to get 9. Okay, so go back and review this chart and be familiar with the different body percentages for the different body regions. Okay, and so we will end there. If you have any questions at all, as always, please feel free to email me or get in contact with me, and I'll be happy to answer as best as I can. I'll see you in the next video.